Atrial flutter on ECG is classically identified by regular, rapid atrial activity, typically around 250 to 350 beats per minute, creating the characteristic sawtooth flutter waves. These waves are best visualized in the inferior leads, 2, 3, and AVF, and often lack a clear isoelectric baseline between them. The ventricular response is usually regular and often occurs in a 2-to-1 conduction ratio, resulting in a ventricular rate near 150 bpm. However, variable block, 3/1 or 4/1, may occur, especially with medications or AV nodal disease. Importantly, unlike atrial fibrillation, the rhythm is regular, unless the AV conduction is variable. Recognizing this pattern is critical for diagnosis and for guiding treatment, especially when rapid rates are mistaken for sinus tachycardia or other supraventricular arrhythmias. In summary, atrial flutter on ECG presents as a regular rhythm with sawtooth flutter waves and often a 2:1 AV response. Accurate recognition is essential for appropriate management and stroke prevention.